So today we're going to demonstrate how we would make a provisional restoration on your full metal crown preparation. And so I'm going to show you first some of the instruments that I like to use. And so I already have instruments laid out here, and that would be the Hollenbach is one of my favorite instruments that you'll be seeing me use. The DeMeo Carver is one of my favorite instruments as well, and I always keep my Explorer nice and handy. These instruments here are composite instruments, and you should not use these composite instruments to do any prying or really hard work on your provisional. If I'm going to use a composite instrument, I'm going to use it when I'm trying to repair one of the margins with some flowable composite. Otherwise, these instruments should not be used because you will break the tips. They're not near as strong as the instrument like is on the DeMeo Carver, which we can actually get a little pressure and put a little pressure on it. The materials that you see up here, we have light-bodied impression material, the PVS, we have the medium-bodied PVS, and we also have the Integrity, which is your interim provisional restoration material. We're going to use some light-bodied for our initial impression because the light body will pick up greater surface detail for us. Because this is just for the fabrication of a provisional restoration and isn't any for our final restoration, we're going to be using a triple tray to take that initial impression before we ever begin the preparation. As we move on down, we have the co-syringe, and the co-syringe I will be using to inject that light-bodied material onto the occlusal surface, again pre-prep, so that I can pick up that surface detail. And then as we move on down, we have some flour of pumice, and we have some toothpaste, and we'll talk about those when we get to the polishing stages. I will mention now that these are kind of the quick way to polish, and you don't get near as good a polish as if we go to the laboratory and we use the flour of pumice and the dry rag wheel for polishing our provisional in the end. And so I'm going to show you both ways. This is if we're really running out of time, you're taking that examination and you don't want to take a chance of fracturing your provisional at the last second, then you might want to just try this at your bench top. But again, you will not get quite the same finish. These are our laboratory burrs that we use for aiding in trimming the margin. For the most part on a provisional, although we can use the burlue wheel, we can also use the sandpaper discs, and they come in a variety of grits, and those sandpaper discs will fit on to this mandrel. Although we have those available, a well-made provisional very rarely needs those. If you use your fine diamond acrylic burr, laboratory burr, to trim around the outside edge and smooth things up, you go to your flour of pumice and your toothpaste, and that will actually get you a nice fitting and also a nice polish to your provisional. If you're having to use something as coarse as these sandpaper discs, you're really working too hard. You're putting a lot of scratches into your final product that are going to cause you problems in getting them out. As we move on down, I always had my number 25 blade and my Barb Parker knife handy for laboratory use. I have the flowable composite here, which will be used if we need to add to a margin. And here we have the articulating paper to check and verify our occlusion. As we go on down, there's still the rest of the instruments in your tray, and we're probably not going to be using those instruments today, so I've left them off to the side just in case I need to grab one at the last second. And then I also always have my laboratory manual out, and I recommend that you keep yours out because everything is outlined in the laboratory manual step by step on how to do this procedure. So if we come back over to our patient presented today for a crown prep on tooth number 19. So you can see from looking at the mannequin head that we have not started this preparation yet, and because this is in the simulation clinic, we have the full entire tooth to work with. So first we want to take and get our pre-treatment impression of that tooth so that we can then begin our preparation. I'm going to use the triple tray. I'm going to have my assistant here help me with loading the triple tray, and I'm going to load the syringe to pick that surface detail on the top that I told you about. Both of us, you can see, are bleeding our cartridges because we always want to make sure that we have a nice even mix before we actually start. For me, I'm going to put the tip in the back of my co-syringe, and just a couple squeezes of the handle, even though I don't see it coming out, is more than enough material that when I put the handle in, I've got pretty much a full syringe, which is a lot more than I'm actually going to need. I'm going to come over to the mannequin head, and we're just going to squirt that in the areas that I want the greatest detail. So for me, that's just on the occlusal surfaces on this side. You don't have to be near as precise with this as we're going to be with our final impression. I'm going to take and I'm going to seat the maxillary teeth, and at this point, even during an examination, I'm allowed to dislodge my typodont, and I'm going to bring the teeth together, and I'm going to hold it there, because if I use the release and the springs, there's too much variance and it may not come all the way together. If you go wrong with this step, you'll end up with a provisional that's high. So I'm taking a look and I'm making sure that all of these teeth are indigitated and are nicely together. Obviously, I can't check the teeth on this side, and so we have to go by the ones on this side, and I hold nice and firm and tight. As long as I don't take the typodont outside the confines of the mannequin head, we won't get in trouble during the examination. Now we have to wait for this material to set. Setting time is going to be probably at least 5 minutes, and maybe up to 7 minutes, because the mannequin head is much cooler than the patient's mouth, so it's going to take a little bit longer here in the simulation clinic. So now that our impression material has been in the mouth for somewhere between 5 to 7 minutes, I'm going to check to see if the material is set enough to remove. So I take a blunt instrument like the side of my Explorer, and I push on the impression material, and the impression material should rebound right back when I remove the instrument and not leave an indent or a line where I touched it with the Explorer. So this is rebounding back, so I think we're fine. I also used the samples that I placed on the coming out of the gun initially to just kind of test to know about when I was going to be ready. So because this is a typodont, everything's going to kind of break loose here, which obviously would not happen in the patient's mouth. But I would ask my patient to open, and I would remove the impression from the patient's mouth, and I'm going to examine to make sure that I've got all the surface detail that I wanted on this impression. When I hold it up to the light, I can actually see some areas of show through there where it is indicating that the upper teeth contacted and touched the lower teeth. In this impression, that's actually good, because that tells me that I had the typodont fully closed. It's important then to trim this, because this has to go back into the patient's mouth, and in this case back in the typodont. So I want to remove the extra without altering the impression and without altering where we're going to make our provisional restoration. So on the side that's going to be our preparation, I'm cutting both of the sides off, making sure that my knife blade doesn't go beyond the cuff of the tissue. And then back here in the posterior region, which would be uncomfortable for the patient to have that put back in, I also want to remove that. I take a little bit of this width off because it's just going to stick out in the cheeks and make it more cumbersome to get back in. On the opposite side, I actually can just trim this down. If I happen to slip and cut a little bit into one of these teeth, all I really need on this side is the occlusal surfaces of the teeth. Okay, so now that we have that trimmed up, we're ready to prepare our patient's tooth and get it ready for the crown prep. I now know that I'm going to make my patient a provisional now that the crown preparation is done. And so in order to make sure that when I'm done that I have good contact between my provisional restoration and the adjacent tooth, I need to make sure that I open up these little windows between the prep tooth and the adjacent tooth. So I'm going to make a couple little slits there, and then I'm going to come around and I'm going to make a couple little slits on the distal. And then I'm going to take my cotton forceps and I'm going to remove those little pieces that I just cut out and establish an open window between the tooth that I have prepped and the adjacent tooth, so that the little trough is open here in between. And I've cut the mesial, so I'm going to do the same thing. If you look clear down inside at the occlusal surface, you can still see the little fin of impression material connecting the buccal and the lingual way down inside here. And that little fin is still good to have in place because that's going to help us create the occlusal embrasure that we want in our final restoration. But this window being open between the preps is going to give us a contact with the adjacent tooth. Because we're dealing with a resin provisional and we're dealing with a resin tooth, the two materials are going to bond and try to stick together, and I would have difficulty in removing my provisional. So this is for typodont purposes only. I'm going to take a very light coat of Vaseline and I'm going to actually Vaseline this preparation. And I'm going to Vaseline the adjacent teeth as well. And again, I would not do this clinically. I would not do this in the patient's mouth. But on the typodont, we need something to keep the two resins from bonding and sticking to each other. I don't want the Vaseline caked on there. I really don't want to see any blobs of it. I just want to know that I have placed a little bit of a light coat on the tooth itself. And now that we have that in place, we're ready to make our provisional. And so in order to make our provisional, I have my integrity material, and it comes with a syringe tip as well. Also, like anything else that comes in a handle, I'm going to bleed the system, so I squirt a little bit out on the bench. I'm then going to take and start loading my impressions, so I want to make sure that I'm on the correct side. I load the occlusal surface first, and I keep my tip in that material the whole entire time so that I don't get air bubbles. I like to draw it up on the walls of the preparation, and once I get enough of it up on the walls of the preparation, then I'm going to stop because I really don't need the whole thing entirely full. I then add one more blob out on the table so that I can use it to judge my setting time. I'm going to place this back in the mouth, generally on the side of my preparation first. I'm then going to bring this loose, and I'm going to put the two members back together, and I'm going to hold nice and tight. A successful key to having a provisional that's not high is to make sure that your typodont is closed all the way down back into the impression. So once again, I reevaluate my occlusion on this side of the typodont to make sure that those teeth are locked together and interdigitated nicely, and I'm holding firmly onto the lower member of the articulator against the upper. We got a little bit of leakage of the material right out here, and that actually is going to give me the opportunity to test that material and see when it is done. That's also the reason that I put the little test blob out here, so I have the start of my mix and the end of my mix represented by this material that's on the paper. Your manual will tell you to leave this from start of the mix about 2 minutes, and right now the start of the mix is nice and rubbery. It's not sticking to my finger. The tail end of the mix is still, I can draw it up just a little bit, so I'm just not quite ready, but we're getting very close. I still would like to be able to work with this material a little bit once I remove the impression from the mouth, so I don't want to let it get too hard or I really won't be able to work with it much. I think we're getting pretty close, so I'm going to take and I'm going to check, and this seems like it's getting hard to me, so we're going to go ahead and remove this from the upper member. I'm then going to take my impression and remove it from the lower, and see if we can get the typodont back into the spot. I now need to remove the provisional, and removing the provisional is where a lot of students break their provisionals. So I use two instruments to help me here, the DeMeo carver and the Hollenbach instrument. I want to make sure that I clear off all of the extra pieces, because any of these extra pieces from the inside or the outside that are attached will potentially cause me problems in removing the provisional. I'm also going to take the adjacent tooth, and I'm going to make sure that I've removed all of the provisional material from the adjacent tooth from the occlusal surface. I'm going to make sure that I've removed it all from this adjacent tooth as well, and from the occlusal surface, because those are areas that will cause it to lock on and potentially cause me problems. I have to do the same thing on the inside as well. Once I've removed all of that from the adjacent teeth, and I make sure that the interproximal area of the adjacent teeth doesn't have anything locked in it, then I want to check these interproximals. You can see this interproximal is totally filled with integrity. And this is where my DeMayo carver comes in, because I'm going to take and I'm going to want to clean that out a little bit and make sure that I get rid of the bulk that's locking into the undercut of the adjacent tooth. I'm going to do that on both sides. I don't have to clean it all out. I just have to make sure that I'm out of the undercut. If I happen to chip the margin on the adjacent tooth or on the provisional, that's one of those areas that we're then going to take and add a little bit to if we have to. I'm also going to look on the inside. So I want to come in here and I want to clean out the lingual the same as I did on the facial surface. So I want to kind of clean out that little bit of a triangle so I'm not locked onto the tooth next to it. Going to do that mesial, and I'm also going to do that distal. Pretty well cleaned out on the distal. Going to do just a little bit more here on the mesial. All right. And while we're here on the lingual, I'm going to pick up my Hollenbach again, because I like to make sure that none has flowed down below the gingiva here that's going to lock onto that tooth, because the tooth has a taper to it. And so if I have a bunch that flowed down below my margin, it's going to prevent me from getting this temporary off also. So if you can see now, when I pull the gingiva down just a little bit, you can see that I don't have any bulk of material down there that's going to interfere with my getting that off. So now we're back on the buckle, and I want to do the same thing out here. I just want to make sure with my Hollenbach that I don't have any abundance of material that is down below the gingiva. So I've cleaned that off nice. Not expecting any problems now in removing this provisional. So this is where a lot of students will pick up a composite instrument to try to remove this, and I encourage you, or definitely tell you not to do that. You'll break the composite instrument. We need something that has some rigidity, and I like to tease it off interproximal, but you see how easy that started to come off, and it's because we did such a good job of cleaning up the area. So I lift a little bit up in the interproximal region on the mesial, lift up on the distal, and then I remove this provisional from the patient's mouth. I have a nice fitting provisional. I have nice margins all the way around, and most of my trim work is already done for me. So although we show in the manual how to use different discs against this provisional to trim it, you really don't have to do a whole lot. Any place that, and I'm not sure how well the camera is going to show that for you, but I've got a little teeny fin of impression material that's sticking up right here. And so I want to trim that off. I can see where my finish line is here, and I can see that I'm just a little bit beyond that finish line. I need to trim that. Interproximally, I've got a real rough area right here, and this is real thick. This is much thicker than my finish line. I need to trim that. I need to trim a little bit on the other interproximal. This surface looks really good. When I actually look at the interproximal, I can see the area where it's contacting the adjacent tooth. I can see that it's bulky and it's thick out here, and I need to smooth that down. but I have an area that I kind of consider the forbidden zone, and that forbidden zone is about 2 millimeters by 2 millimeters or so right here where the provisional contacts the adjacent tooth. I'm not going to touch that area. So when I use my burr, I'm going to angle it on both interproximals so that I don't touch that spot. So I'm going to kind of do this over the patient's face because that's where the camera is right now, but I wouldn't do this over the patient's mouth in any other circumstances. I'm using my very fine diamond acrylic burr to adjust this. I'm angling so that my burr is away from the tooth so that when I'm touching it, I'm only touching it up around the margin, and I'm only touching it on the facial or the lingual where I want to smooth that, and I'm avoiding that, what I call the danger zone, or the area that I don't want to remove my entire contact. So we're just going to take a couple seconds here to go around and kind of smooth that so that I get a nice smooth transition. Remember, I said I have a little bit of a fin of the material right here, so I want to take and I want to relieve that just a little, taper that back down to my finish line. And the same here, I have that thick margin that I need to relieve a little bit and get that back down to a nice margin. Because our provisional is going to fit fairly well, we may or may not actually have to add to a margin. But we'll take a look at it and we'll see what it looks like after we put it on. Polishing is going to be really easy because the best polish is an untouched polish. So I like the fact that we're not having to grind on this a whole bunch. So we're going to be fairly smooth right out of the gate. Going to try the provisional back on, and we're going to check our margins. Margins feel pretty good along here. I'm missing a little piece of the margin right here. We're open just a little bit on the interproximal. When I check the lingual, we're actually good all the way along the lingual when I check it with my Explorer. So let's take a minute and show you how I would add to that provisional. So because we have a little deficit right here, and we know that that's right here on the preparation, the first thing I'm going to do is touch it with just a little bit more Vaseline, because again, we're dealing with resins, and we don't want the two resins to adhere, but I need to make sure that I don't have enough Vaseline on there that's going to interfere with capturing that margin. The way in which I like to then do it is to add my flowable material directly down, blow just a little bit of air just in case there's, make sure we thin that Vaseline out. I'm going to take and put a little bit of flowable resin right on the margin where I know I was short. How much I put depends on how short I felt I was. I'm now going to seat my provisional into place, and I'm going to make sure that I'm all the way down. At this point, it's okay to use your composite instrument. So if I could just get one of those flat. So at this point, it's okay to use the composite instrument to make sure that that flowable material gets smoothed off and doesn't lock onto the interproximal area here. Once I feel I have that material where I want it to be and we're fairly smooth, I really, you notice, have my thumb on the top of that provisional. In the patient's mouth, I would be coming this way so that I have it. My assistant would actually be coming through with the light, and we're going to cure this for 40 seconds. Okay? Being honest with you, you can't really over-cure the flowable. You can't over-cure the composite. But what you can do is actually build up heat, because there's a little heat release to this light. So if you're too close to the patient's tooth, they'll begin to sense that heat and you don't want to overheat the tooth or the pulp. Okay, so after 40 seconds have passed, we're going to take and we're going to remove our provisional. Depending on how well you did with the Vaseline, sometimes it comes off tough and sometimes it comes off really easy. And in this case, it came off nice and we were able to pick those margins back up. So we now have a nice provisional. We put it back on and we take our Explorer. We're now going to find that those margins are now closed. When I look at the marginal ridges of the provisional to the adjacent tooth, they look pretty even. They look to be the same height. So I'm anticipating that I didn't elongate the provisional, and the chances are we're pretty close. I'm going to place the mandibular arch against the maxillary. I'm looking for any rock that might occur front to back. I'm looking for any rock that might occur side to side or anterior to posterior. If I did have a rock, I would remove the provisional and then see if I had the same rock without the provisional in place. If I have a rock with the provisional in but not with the provisional out, then I know it's my provisional that's causing that rock. If it's the same with and without the provisional, then I know I probably had a irregularity in the occlusion before I ever started. I'm also going to check my provisional with articulating paper. So I'm going to place the articulating paper in. I'm going to squeeze the Typodont together and try to rock it just a little bit, and then I'm going to open my provisional to see if I have contacts. You know that on the mandibular arch, the centric holding cusps, the functional cusps are the buccal cusps. So since I have contact back here, I have contact here, I have contact here, this is a good contact for me. I may take and squeeze the Typodont back together again to see if I had any false positives on my readings, because that really should transfer the black onto the red. And so now I have black on red here, I have black on red here, I actually have black on red right here, and I do also back here. So I'm actually very happy with the occlusion. Clinically, we would want to check this in an excursive movement, in a working movement. We'd want to check it in a non-working movement, and we would want to check it in a protrusive movement. And those things are just next to impossible to actually verify and check on the Typodont. The next step of making this provisional is to polish it. So when I remove the provisional, again, there are two ways. I'm going to kind of show you the shortcut method here, which is if I have just a few minutes left in the patient's appointment, or I only have a few minutes left in my practical examination, and I don't want to take a chance that I'm going to lose this in the lathe wheel and it may shatter on me. So I can use some flour of pumice and I can use some toothpaste to polish this chair side. Again, I'm going to do this kind of here for the camera's sake so we don't have to move everything. This is some flour of pumice. It's very, very fine. I would mix the flour of pumice with a little bit of water to make it wet. All right, and then we're going to take and we're going to use just a Profi cup, just like we were polishing the patient's teeth, and I pick up the flour of pumice into the Profi cup, and I'm going to go over the provisional with the flour of pumice. Just some nice even strokes, staying away from but getting close to my finish line. I don't want to alter the finish line. When I come around to the interproximal region, I'm also going to be very careful and not polish at this stage with the flour of pumice my danger zone, that 2 millimeters by 2 millimeters where I want to end up with contact with the adjacent tooth. You want to keep your flower of pumice wet all the time. So as the pumice dries out, you want to re-dip and get some more material. You can do the occlusal surface with this as well. Depending on how rough you made your provisional will determine how much you can get by with just the flower and the pumice chair side, and whether you really need to go to the lathe wheel. At the very end of this, we're going to take you back to the lab, and I'm going to show you how I would do this on the lathe wheel as well. So once I've gone around with the flower of pumice, I'm going to wash my provisional off really well. While Pedro's washing this off for me, I'm going to show you that flower of pumice does come in a prophy paste form, and so we can use this. I find it's not as wet, so it's okay, but it's a little bit pasty for me, so I actually still like to add some water to this to mix it up. Okay, for polishing a provisional, it's just too stiff as it is that way. Yeah, so I'm going to reuse my prophy cup. I used it with the flower of pumice, and so then I washed the prophy cup out to get rid of any of the flower of pumice. And now I'm just going to actually take a little Crest toothpaste, which has a little bit of pumice actually in it itself, but it also is going to polish and shine really nicely. And we're going to take our provisional, and I'm going to do the same thing that I did with the pumice, but I'm now going to do it with the toothpaste. Just as a side note, I know that your manual refers to adding contact between the interproximal teeth and your provisional, with adding that contact back if you don't have it using the flowable. My honest advice to you is that if you don't have contact with the adjacent tooth, you should reevaluate your impression. Make sure you cut those little windows open so that the material will flow through, and make yourself a new provisional. When you master this technique, it is much faster to remake the provisional than it is to try to add to that interproximal contact. Adding to the margins was pretty fast, pretty simple. Adding to the interproximal contact is a lot tougher. So we're going to ask Pedro once again to wash that off, and then we're going to take a look at it, and then we're going to retreat to the laboratory, and I'll show you how I would hold that against the lathe wheel to do this polishing step in the laboratory. If you noticed, I didn't use any sandpaper discs. I didn't use any Burlue wheels. They are available for you, but if you're having to use those, you're creating a lot of scratches and a lot of alterations in the provisional, and then you have to polish all of those back out. And again, my advice is, if your provisional is that far off that you're having to make that many adjustments, then you probably should consider just making a new provisional. So there's our provisional in place. When we go to the lab and we polish it again, you'll be able to get a little bit better shine on it in the lab. This would be smooth to the patient, it would be comfortable to the patient, the occlusion's correct, the interproximal contacts are good, the gingival embrasures are correct, not impinging upon tissue. We're going to have good gingival health when the patient comes back for the final restoration. If we look on the inside, we can see that we also fit nicely to the margin, that we also have gingival embrasures that are open. We have nice occlusal embrasures. When we look at it from the top, we can see that we have the occlusal embrasures. We can see that we have lingual embrasures, buccal embrasures. Everything looks the way it should. Your board examinations today actually check it visual. In today's world, the REB examination, the NERB examination, they actually visualize, and as long as they can't see light shining all the way through, then they assume it's a closed contact and they accept that. So in the old days, we would check our interproximal contacts with floss, and we would like to feel a nice tight contact with a snap of the floss as it goes down to place, and then a snap as the floss would come back up. So there we go, we've got nice snap in and out. We're back in the laboratory now, and we're going to start with a wet wheel. Just like we wanted our pumice wet at the bench top, we want our rag wheel wet here. If you come back and this wheel is all dried out, you have a couple choices. One would be to remove the wheel. Secondly, is we do have the cast trimmer right next to it, which has a water syringe with it, so we can actually spray water on the wheel and wet our pumice. This pumice is pretty wet, but that's good because I like my pumice nice and wet. We would normally flip the door down, but we're going to leave it up for the sake of the camera, so I'm going to just spin it for a second to make sure I don't get splattered with water, and then we'll put that up. But you would normally leave this down and work underneath it. In this case, with a provisional, the most important thing is that I'm going to protect those margins. I'm going to take some pumice, and I'm going to apply some pumice onto my provisional, but I'm going to keep adding more pumice, and I'm going to begin to work against the lathe wheel. I want to hold on to this nice and tight because that lathe wheel will grab it and spin it right out of your hands. I'm going to rotate it, and as I rotate it, I'm adding more pumice to it. And again, my fingers are over top of my margins, so I'm protecting those margins with that finger. I'm not going to hit my forbidden zone as much. I want to go very lightly and very quickly over it because I don't want to take a chance of removing any of the resin and ending up opening up my contact. Once I've made my way all the way around, I can tip it the other way if I want to. I'm going to again hold my fingers there though and make sure that I'm protecting my margins. I'm then going to very carefully hold on to it and do the occlusal surface. You can flatten your occlusal surface fairly quickly with this pumice, so I really don't want to use a lot of pumice. Rephrase that, I really don't want to use a lot of pressure and hold it against the wheel too long. I want to preserve all that nice anatomy that I have in my provisional. At this point, I'm going to turn the lathe off and I'm going to wash it off over here at the sink. These sinks have nice strainers in them, so if for some reason I was to let go of my provisional, I'd be okay because the strainer would catch it for me. And then we're going to take and dry the provisional with a paper towel, because the next step is to use a dry wheel. I like to keep my pumice wheels and my dry wheels separate from each other. You can actually see already that we have a fairly nice looking, fairly smooth, still have our anatomy in our provisional. Okay, but now it's where we're going to get the shine. So we're going to move over here and we're going to use the dry wheel. It's labeled dry so that students don't get pumice on this wheel. The wheel is dry, and I have some polishing cream, some polishing paste that came out of this can. Because I don't know how long it's been since polishing cream has been added to this wheel, I'm going to add a little bit, but you don't need a lot. I'm going to turn it on low, and I'm just going to hold the polishing cream against the wheel. I'm just going to place a little polishing cream on there, and that's all we're going to need. We're not going to have to keep redoing it. I'm going to do the same thing. I'm going to hold my provisional between my fingers. I'm going to protect the margin. I'm going to go up against the provisional. I am putting a little bit of pressure on here. At this point, I don't have to be quite as careful with my interproximals because this polishing cream is probably not going to remove any resin. It's just going to make everything nice and shiny for us. You're going to see that we end up with a better shine than we actually had from the toothpaste. So this is definitely a better way to do it unless you're in a hurry and you're afraid that you're going to break it in that last few minutes of the examination and not have time to redo it. Otherwise, I wouldn't shortcut it. So now we're going to turn the lathe wheel off and we're going to examine it. And Hopefully the camera will show you that this has more of a shine than we had with just the pumice finish. And if you compare back, you should see that this has more of a shine than it does with the toothpaste. The last test is, of course, to put it back in the patient's mouth and make sure that the margins still fit and that the margins still look good to us and that we still have interproximal contact. And I would say with this provisional, we do have all of those things. So now that we have our provisional restoration, we're going to take it back to the patient's mouth and we're going to verify its fit. We're going to make sure we didn't alter anything with the pumice and the polishing process. Once we've verified that everything still fits, this is the time when we set our provisional restoration aside and we're going to take our final impression. Because remember, your provisional restorations help you evaluate your preparation. If there was a problem in our preparation, we would have wanted to correct it before we continued on and remake the provisional. Because we didn't have any problems getting our provisional on and off, because we could tell that we had enough thickness, we know that we have a fairly decent prep, because if we can make a provisional, the lab can probably make the crown for us. So at this point, we're going to now be cleared to take our final impression. And after the final impression, we would cement our provisional restoration with a provisional cement so that we can remove it when the crown comes back from the lab and then cement that with permanent cement. So that completes the demonstration on how to fabricate a provisional restoration and modify the margins if you need to, and then polish that final provisional restoration. Thank you.